with great pleasure that I invite two very young people to come and tell us what they've done with the drive calculator. I am honored to introduce Sam Ranger, that's my white son, and Maya Birhiray, my black daughter.
Thanks, everyone. Good morning. So, as my dad so kindly introduced us, I'm Maya Birhiray,
I'm Sam Ranger.
and we're here to talk to you about our Drive calculator and the rank score for Drive. So, these are our disclosures. So, I'm sure my dad showed this presentation. I'm going to lower this just a little bit in his presentation, but this is our rank score for Drive. To give you guys kind of an idea, it goes from 0 to 5, 5 being the highest and the best, and 0 being not what we're aiming for. And then 3 is that threshold, like my father mentioned, for clinical trial excellence. The important thing that is not noted on this Drive rank score chart, but we wanted to make note of, is for any studies that we are not able to get demographic data for, or the demographic data is reported with a race and ethnicity separate, so not in non-Hispanic white, non-Hispanic black, that kind of deal, we are awarding them a 0. So that is, once again, not what you're trying to achieve. We are trying to achieve a 3 or higher for clinical trial excellence. I am so sorry. I forgot one other thing. I'm not sure how many of you are aware, but on April 8th of last year, the OSMB made updates to the minimum categories for race and ethnicity. They updated the reporting status so that there are now 7 minimal categories that you need to include. That included teasing out Asian and Pacific American into 2 separate categories. So now the category is Native Hawaiian and Pacific Islander, as well as adding a Middle Eastern and North African category for minimum reporting. The calculator does not yet represent that because we are waiting on the data to be reflected in SEER and SEER stat.
Yeah, so Dr. Birhiray kind of showed this image earlier, and if any of you were here last year, this might look kind of familiar, but this is the drive score calculator that we have been working on over the past couple of years. But there is a new section, and that is catchment area. So we have reflected, we'll talk a little bit about this more later, but there have been some surveys that we've been doing, and geospatial data is something that you guys are really wanting. So based on maybe a smaller clinic or just more of a local clinic, that maybe your racial distribution is not the same as the rest of the whole continental US. So we are adding in this catchment area. It's not yet active, but here's an example of what it would look like, where you select your drop down of your catchment area before selecting your cancer type. And so you're only scored based on your catchment area and your local population. So Maya's going to talk a little bit about what we've been doing over the past year, and then I'll continue on to some steps about the future.
So we have expanded the calculator to include 35 distinct cancer types, and those are not just limited to hematology. It is cancers across the board. Excuse me. In July of this year, we conducted an internal survey at the Drive Maui meeting, which is where we discovered that a lot of people were seeking out that geographic expansion for our calculator. We're going to talk a little bit more about our internal survey and getting more information from all of you to continue to update the calculator, but that's what gave us our geospatial data. We also presented a poster presentation at the 66th annual ASH annual meeting. Unfortunately, Sam was not there, so I had to present all by myself, but it was definitely a team effort, as well as having a additional abstract publication in the online only abstract publication that talked about how we developed our calculator over the past year. We also, with that, with our abstract that was selected for presentation, we were also invited by the editorial board of Blood to expand that into a full manuscript. So we are working on that over the next couple of weeks and months and hoping to be published by the end of the year.
Yes. So, speaking more on the geospatial data, so the way that we are expanding and using that catchment area data is thanks to Dr. Wingfield for letting us in on this information, but we are currently in the process of working with the University of Kentucky using their Cancer in Focus data. And so what they are doing is they're collecting data from the catchment areas all across the US and collecting all of that data, including demographic data, as one of their PhD candidates' thesis. And so we are in contact with them, trying to get their program kind of integrated into ours to make it easier for everyone to use the calculator and ensure that they're using the correct catchment area. As Maya mentioned, we are in contact with Ash and Blood, but in part of that, we are also working with the Senior Director of Publications at Ash in order to update their demographic data reporting policies to help improve those and make sure that they are truly representative. We also had a submission of our abstract to ASCO's annual meeting, similar to the ASH abstract. So we're hoping to hear back from that. And then we also just submitted an abstract to the Oltmann Lymphoma Conference with less of a focus on Oltmann's past history with their scoring, but instead looking at the FDA drug approvals over the past year and how those reflect whether or not they are representative, whether or not they're generalizable and transportable based on that minimum drive score of 3 for clinical trial excellence. We've also been collaborating with the European Hematology Association, working on getting an editorial in there and also updating their diversity reporting policies in Europe. So, how does this affect you is kind of the question you might be thinking. And so what we've talked about, and we keep saying this, it's a score of 3 is our minimum. And so that means if you have a 3, 4, or 5, we deem you to have clinical trial excellence, meaning that your data is generalizable, your data is transportable, and therefore is effective to the whole population that you're trying to treat and not just certain groups. So we are trying to use the calculator to drive enrollment goals, to ensure that data is generalizable and transportable to all patients regardless of their minority status. And we're hoping to employ the score to assess the clinical trial or the clinical relevance of drugs that you're using on your patients. So this is a tool that can be used to, when you are evaluating whether or not a patient needs a certain drug, you can use the calculator, say they got a score of 1, so maybe this won't affect my minority patients as well as it should, but this one got a 5, and so this is the one I'm going to go with because I know that this one treated Black patients or treated Hispanic patients effectively and was representative. So Maya's going to take over here.
So continuing thinking about our tool utilization, we have these 2 QR codes which are going to take you to 2 different surveys. They're labeled appropriately. So our internal validity survey is going to be very similar to the one that was completed in Maui in July of last year, but with some updated questions. So anyone who has already filled out our internal validity score, our survey, we would really appreciate if you filled it out again, especially, like we said, we got our geospatial information and expansion because of what was being asked of us. And so it's really going to be important that you all fill it out. You let us know how you feel about the calculator. Is it working? Do you feel like the information is relevant? And then flipping over to the clinical relevancy survey, it's very similar, but it's a little bit more geared towards physicians and your clinical practices and the information that you will or will not use when you're treating your patients. Also related to this, but we don't have a QR code for this listed up here. If you go out into the main hall, you will see a giant poster which says our Maui Declaration, which is what we pledged and all signed to in Maui in July of this past year. If you would like to read it and sign it, the full document is available on our website, but a shortened form of just the pledge is available outside, and you can go ahead and sign it, and we'd really appreciate it if you took the pledge with us.
Yeah, so here are just our acknowledgments. We'd like to thank Indie Hematology Education. The calculator would not happen. This meeting would not happen. You all probably wouldn't be here if this hadn't been for Indie Hematology Education. We really appreciate them and all of their support.